So just a couple other classes of substances with mixed chemical properties. We already talked about nicotine and cannabis or marijuana. Talking now about a couple other substances that don't really fit neatly into any of the categories we've talked about so far. And the first one is inhalants. Inhalants are drugs that are inhaled, solvents, aerosol sprays, and compressed air products. Most common among 12 to 17-year-olds, with chronic use among white males. Effects vary and are brief, resulting in repeated huffing or inhaling to extend intoxication. And they can impair coordination, judgment, as well as cause euphoria, dizziness, and slurred speech. Hypoxia or oxygen deprivation results in acute and persistent cognitive deficit. So any episode of inhalant use, even for first-time users, can actually result in a stroke, acute respiratory distress, or sudden heart failure, and this is sudden sniffing death. And the fatal outcome is most common with compressed air products, aerosol sprays, air fresheners, butane, propane, and nitrous oxide. So, and of course, emotional and interpersonal difficulties are associated with use as well. Paranoia, violence in interpersonal relationships, suicidal ideation, anxiety, and depression. And our last substance with mixed chemical properties is ecstasy. It has both stimulant and hallucinogenic properties. It's also known as MDMA or Molly. And MDMA or Molly ecstasy is sold in little pills that look like Pez. It looks really harmless or innocuous, and people tend to think of it as harmless, but it can cause death. The primary way that it causes death is by increasing the body temperature. So people show up in the emergency room with body temperatures of 107, 108, and they've literally cooked their brains. And a good way to know if ecstasy is present at a party is often at ecstasy parties there's not alcohol present. Instead, people would be sucking on things like those big ring pops or other things that they want to suck on, sometimes adult sort of size pacifiers. It makes you want to chew on or suck on something, so people sometimes even will chew a hole in the side of their own mouths. And also at the parties they might be selling bottles of water for $10 or $20. That's another sign that it might be present. And drug dependence develops rapidly, even among infrequent users, and it can be associated with long-lasting brain damage in areas of the brain that are critical for thought and memory. And in addition to death through hyperthermia, death can occur through atherosclerosis or hardening of the arteries. 58% of individuals for whom ecstasy was the cause of death showed atherosclerosis. And remember that with club drugs and other chemicals that we've talked about, there can be a synergistic effect where the drugs can potentiate each other, multiply or increase one another's effect. So some of the most dangerous combinations are tranquilizers and alcohol, stimulants with sleeping pills, multiple drug use, and ecstasy and alcohol and caffeine. Trying to use one drug to counteract the other, such as using stimulants to feel alert after taking a sleeping pill, can be especially dangerous. And high levels of caffeine, like with energy drinks, can mask the symptoms of serious intoxication.